Well, welcome to our webinar this morning, and thank you so much for your patience. We just wanted to allow as much time as possible to have those that might have been trying to download software or get the webinar downloaded properly to be able to hear and see the webinar. So thank you for your patience, and thank you for taking time to join us this morning. We know your time is precious as well, and we want to honor that and go through a information piece here this morning. Talks about our allied products, talks about our underwriting, some really great changes and positive things that we are doing. But before we get into it, a couple of just real quick housekeeping details. First of all, your microphones are muted, so they'll stay muted throughout the entire webinar to preserve sound quality here overall. But if you have a question, you'll note that there's a text box on your screen, and you can text a question to us. And we'll make an effort at the end of the webinar to answer those questions as well. And if we don't get to all of them, we'll send you an email that has all of the questions that were asked and all the answers provided as well to you, along with a copy of the recorded webinar as well. So just keep that in mind, and we appreciate your courtesy. And as you see something and you have a question, use that chat box to put that question, and we'll be more than happy to answer that question as we go along at the end of the webinar itself. So without further ado, let's go ahead and get started here with the webinar and the information of where we're going with this. See if we can advance our next slide. There we go. So I'm just going to take just a quick moment here to remind you about Allied National. We are a TPA, third-party administrator. We've been in business for over 50 plus years. We're part of 90 Degree Benefits, which is a large family company that's under the parent company of Blue Cross and Blue Shield of Alabama. As you recall, Allied National has always been and continues to be a company about providing the needs of group health benefits for small to medium and large size groups. Our sweet spot is the 2 to 50 marketplace, but we write groups between 2 and 125 lives very easily, all on a level funded platform we call a 1221 plan. 12 months for the plan year, plus 9 months for a run out period, and then we also will offer a refund of 100% of the remaining dollars you left in that claims fund to go back to the employer after that run-out period is over. About 40% of all of our groups get a refund opportunity back. Our stop-loss carrier, Fidelity Security Life, is an A-rated company as well. So we do everything all under one roof here in Overland Park, Kansas. Our underwriting, claims, client services, legal, marketing, everything here in Overland Park, Kansas. So let's take a moment to dive in again to our products and where we're going with on today's plan. You might ask, well, what are the types of plans that Allied National is offering? Because we have made some changes to those here. So the first thing that we talk about is that we've got a MEC product called our minimum essential coverage. We're going to talk about that first. Then we also have a MEC product as well with our cost saver, which actually has also a bronze level plan. The two plans are plans that are limited benefit plans and satisfy the minimum essential requirement plan. We're also going to talk about our funding advantage freedom plans, which are our full major medical plans. And of course, we're also going to talk about our traditional PPO plans as well. So let's dive into this here, just as a quick reminder to you that our minimum essential coverage plans, which are MEC-only plans, are a guaranteed issue. So you don't have to worry about medical underwriting. You do still meet participation, but the guarantee issue from the medical perspective, they are indeed very affordable and very compliant and meeting minimum essential coverage as well. 100% preventative care with no deductibles and no annual lifetime limits as well. And that makes this MEC plan a really unique product. So it satisfies the Affordable Care Act employer mandate to provide minimum essential coverage and eliminates the Part A penalty for applicable large employers. Level funded plan, it is where the employer pays a really low monthly premium that covers all the costs to the plan. And at the end of the plan year, of course, that's a run out period following that, any and all unused dollars in the claims fund is 100% refundable back to the employer. That makes this a really great plan. When we showed you just a moment ago a slide that showed you all the types of plans that Allied has, we really believe that we've got a group health product that fits nearly every employer budget that's out there. That employer says, I've looked at the major medical plans and I just cannot afford that. I need something with half the cost or less than half the cost. Boy, we've got something for every employer group out there to help meet their budget and what they have. Overall, Allied National's MEC plan highlights is it offers 100% coverage with no copays and deductibles, annual lifetime limits. And you have a network on this product as well through First Health EPO network. Now, this is where the employer-paid core of the MEC plan with a buy-up options, and that's what makes this new product really exciting and really new, and that we've had for a number of years, this MEC product as a product to satisfy the applicable large employer groups problem of trying to meet minimum essential coverage. So we have found that we not only are able to help the applicable large employer, that many small groups and medium-sized groups also purchase this product because the pricing is very affordable. And with our enhanced features that we're going to show you here, this becomes an opportunity to allow an employee to buy up, maybe offering additional coverage such as an office visit benefit, as well as some other office visit and urgent care benefits, and even coverage for us image scan as well. So our level funded plan with a refund potential, and now with a new feature, our telemedicine visit with the $0 copay. Now the telemedicine is now going to be new on September 1st for all of our major medical as well as our MEC and cost saver plans. And this is one provider through Recuro that the member will have access on their smartphone, online computer as well. And we'll talk about that in a moment, but that comes with no cost to the member whatsoever. So a really great opportunity. So let's take a look now at these three levels of coverage. There's the MEC plan, minimum essential coverage. This is paid at 100% by the employer at $46 a month. Preventative services are simply covered at 100%, and the preventative services are all the services that are listed through the U.S. Task Force on Preventative Services and Care. We just follow those, and those are all going to be covered as a preventative care. Remember, it's based on the member's age and their gender. Obviously, there are children that have preventative services that adults don't have, and there's preventative services that adults have as well too. So we're just following that piece. And then there's a prescription drug discount that comes with this, and free and unlimited telemedicine makes this really a superior product offer, because that's usually has been the feedback that you have provided to us over the last year or so here. How can we offer some more, so to speak, bells and whistles? How can we offer some more features on that MEC product to help you sell that to the client? Well, here's making that basic MEC a really cost affordable plan with free telehealth and prescription drug discounts, along with the preventative care service as well. But if the member says, I'd like to have an office visit, then they can buy up to our MEC Plus. And this is $78 a month. And that's still going to have the preventative services. It's still going to have the prescription drug discount and one primary care visit with no copay. So that would be really easy and simple to use. And for that member that says, hey, I can afford the difference between $46 and $78 and get free telehealth and get one primary care visit, boy, that's the plan for me. And that employee can buy up because the employer's paying the MEC at $46 at 100%. Then you've got the MEC Advantage plan, another buy-up option, which is going to really have some additional pieces to it. So we're covering all the preventative services, but now we're going to have a $10 copay for the generic drugs, plus 3 primary care visits with $20 copay. That's nothing to shake a stick at. That's what really members want, is office visits. And here, a small dollar amount buy-up gives them 3 primary care visits with a $20 copay. Then 3 specialist or urgent care visits with a $50 copay. 5 is not lab, but lab or x-ray services with a $50 copay. And 1 diagnostic testing, such as a PET scan, MRI, and such, with a $200 copay, again with the free telehealth. And that's what makes this MEC product really superior in helping groups that maybe have got a class of people that have been left off and don't have any coverage and are exposing that employer, if they were an applicable large employer, to not being able to fully satisfy the requirements to have a MEC product in place. Here's an affordable way for that employer and for the member to afford to have some coverage that maybe they might not have. So you could class it out if you want to, or offer all these as buy-up options for the entire group based on what the employer's needs are going to be. So our pricing on this is effective 9/1/25 with this structure. Our MEC product for the employee rate is $46. The employee spouse gets $78, so a little bit of a break there. Employee plus child, 78, and then the family rate's 110. And then for the MEC plus buy-up option, it starts at $57, and then the employee spouse rates have their rates, as you can see there on your screen. And then the MEC Advantage buy-up option, again, has those options as well. So we also have a type of a spreadsheet upon your request that we can provide that you can enter in the number of employees that is going to be on a plan and their dependent status, and we'll give you these rates as well, in addition to our software at Win Allied that we can also quote for you as well. Now, the MEC plan requirements does have a minimum standard of 5 employees with 100% employee participation after waivers. So that makes it pretty easy. 5 lives is where this starts. Now, our other plans, including the cost saver, everything there starts at 2 lives, but for the MEC plan, it does start at 5 lives. So 100% employer contribution for employee MEC premium as well. And full time for us is always going to be at 30 hours, unless maybe an employer defines coverage for a lower hours amount, and we can work with that as well. We just need to know that up front when you make a submission so we can understand that we're going to have maybe 25-hour employees getting the MEC plan versus the 30. We just need to know that up front so that we can communicate that and be effective with that for you. So that makes this MEC plan really a very superior plan. And so you might think that who are you reaching as far as your target market on this? Well, large and small employer groups, I'm happy to say. And it's amazing how many 7, 6, 5 live groups really love this MEC product. Plus, small groups needing to satisfy the ACA Part A requirements and no current health insurance plan in place. It's amazing how many groups that are out there, how many employer groups that are small especially, have no health coverage, would like to have this offered to them. And also, you can offer it to a class carve-out as well. So let's transition, if we can, real briefly here to our cost saver product. So this is also a MEC product, and it comes with 2 plans that are MEC only and 1/3 option, which is a bronze plan, meaning that this MEC product that we just offered and this cost saver as well also has no medical underwriting to it whatsoever. And it covers 100% preventative care. But here on the cost saver, you have a choice of 2 nationwide PPO networks. You can either choose PHCS as one option, or you could also choose First Health as well. Those are on the cost saver for a network option. Now, Allied's National Cost Saver Plan satisfies the ACA employer mandate to provide minimum essential coverage and minimum value to eliminate Part A and Part B penalties for applicable large employers. Now, keep this in mind, the level funded plan employers pay a low monthly premium. So for that employer that might even be, just as an example here, saying, boy, I can't afford $300 a month, really can't afford $200. I could probably do something for $100 or less. This is where the MEC comes in. You can walk out of a client call with a sale when you show them these MEC products of cost saver or the MEC plans we just reviewed. So at the end of the plan year, that's after the run out period as well, any and all unused dollars in the claims fund is refunded at 100% refundable back to the employer. We make it simple. We just write a check to the employer group, and the employer group can then send us back the check, and they can buy down future monthly payments if they renew. We do real well, by the way, on renewals. About 80% of our groups do renew with Allied. So it's not consequential that they can simply get a refund, but they can also use that to buy down future payment as well. That's a real effective way of helping them satisfy a requirement of providing the welfare benefit of the money that's refunded back to the employer group by using it to buy down future monthly payment as well, whether they renew or not with this, by the way. Okay, let's look at Allied National's cost saver a little bit more in detail. We talked about the preventative care at 100%. It's got, even though we call this a limited benefit plan, this is what I call the oxymoron of this product. We call it an unlimited outpatient and physician benefit. So we're going to pay an unlimited amount for a limited plan. So I'll let you look at that later on to try to figure out a little piece I just said, but unlimited outpatient and physician benefits. It's a choice of either First Health or PPO Network or PHCS. $0 cost for your lab test of select providers. It is a level funded plan with a refund potential, and it comes again with what I mentioned earlier, our telehealth service as well, with a $0 copay as well. It has a small deductible because really, when you think about this cost saver, a lot of hourly workers are probably going to be signed up on this cost saver. We seem to have a lot of groups that have been on this for years and really find it advantageous and are very satisfied with this product. It has a low $250 deductible, waived for office urgent care visits. Co-insurance is real simple. It's 100% for all benefits after deductible and any applicable co-pays to a maximum out of pocket of just $2,500 per person in network. So again, low out-of-pocket maximums. If we haven't got your attention on the cost saver yet, again, low out-of-pocket maximums. Nothing like repeating and repeating. If you happen to go out of network on this, there's no fees or penalties. We're just going to pay out the claim based on our network benefits, which is our reference-based pricing model, at 125% of Medicare with no maximum out-of-pocket balance billing. Okay, so let's take a look at these unlimited outpatient benefits. Excuse me here. Pardon me, I had to clear my throat. Pardon me, smoke. All right, thank you for your patience. So our office visits have a $40 copay per visit, or on our Plan 3, the Bronze has a $30 copay. Urgent care has a $60 copay or a $50 copay on Plan 3. And for physician, lab, and x-rays, $50 copay on down the line through a scan, which has a $300 copay, physician, inpatient, outpatient surgery, and a $500 copay. The maximum benefit is unlimited. So this is the category of outpatient and physician benefits. Plans 1 and 2 does come with a generic drug offer and also are covered at a $15 copay, while the Bronze plan offers those generic payments as well, but preferred brand name drugs are covered, which makes this an MVP plan, are covered at 50% coinsurance. So it really gives you a great opportunity to help an employer provide an affordable plan and have great benefits that are going to be of help to them. But what about the facilities? Well, let's answer that next year. Let's see, just move this here forward here. Okay, the fixed benefits here are based on, again, our 3 plans here, but this is where the member would get reimbursed for any type of outpatient surgery facility charge, which is limited to 3 per year. You'll have Plan 1 at $1,000 maximum benefit. Plan 3 is up to $2,000, limit 3 per year. Then you're going to have your inpatient surgery facility, which will be between $1,000 and $2,000. Your inpatient daily benefit standard room will be between $500 and $1,000. And then your inpatient daily benefit for ICU, which is limited to 30 days and combined total inpatient days per year, will be between $1,000 and $2,000. So your maximum annual benefit will be between $35,000 and up to $70,000. So on the fixed indemnity, no one's trying to hide the fact that there is an exposure opportunity here. But with that exposure, you then have an opportunity to sell voluntary plans as well to help meet the needs of your employer group going on the cost saving plan. For the groups that have not had any type of coverage before, this becomes a great option to help them out. The cost saver plan requirements Cost saver plan requirements, minimum of 2 employees. Rating is based on the gender, age, and group demographics. So for 5 lives or fewer, we're going to use age banded rating. And for 6 or more, we're going to use composite rating. 75% of the eligible employees after valid waivers, or 40% of the eligible employees in the group. This is new for us because we used to offer 50%, and now we're offering 40% of eligible employees in the group. And then employer contribution is just a minimum of 25%. Well, we're going to move to our next screen here. Pardon me just a moment here. Let's see. There we go. So the cost saver target audience is for groups offering health insurance for the first time. So we really want to emphasize there's plenty of small to medium-sized groups out there where you can really offer this cost saver to. It needs to be affordable healthcare to replace rising cost of fully insured plans, and hourly employees, healthcare professionals like nursing homes, home healthcare providers, as well as construction trades are also a part of that as well too. So let's talk about real briefly our virtual urgent care. So first of all, it's offering 24/7 access. It gives you a multi-channel option of live video, phone options to let each patient receive care the way they like. Also, it provides what we call high trust. Now, this is a really neat feature, which plays a crucial role in ensuring the highest level of IT protection for patient data through an in-depth system analysis of Recurso's infrastructure and platform services. So privacy is of utmost respect here, and the protection of that is of the utmost respect as well, too. Also, through consult transcription, in other words, consults can be recorded and transcribed, allowing the patient continuous access to information. This allows patients to review their care plans with family or caregivers as needed. So this telehealth feature, again, has no cost to the member, and it really becomes a superior way to get instant 24-hour access anytime, day or night, to have an urgent question or a medical concern that you've got that's non-emergency that can be there to assist you as well. So this and these are our plans we've talked about. We've got our full major medical plans as well. And the full major medical plans that we offer include, anytime we use the word freedom, the freedom plan, that means we're going without a network. And so our freedom plan becomes a plan that uses reference-based pricing. And with that, we're paying doctors at 125% of Medicare, and we're paying facilities at 150% of Medicare. And we have one product I'm just going to close with here in addition, because a lot of you have heard our full major medical plans before. But when we use our Freedom Plan, of course, that comes without a network. But we have one unique product called the Freedom Hybrid product. Now, the Freedom Hybrid product is a plan that has a physicians-only network. And for your groups that you're bringing on to Allied National that maybe have never gone without a network and are looking at going without a network with the plan that you're recommending, the hybrid becomes a great stepping stone product that you can recommend to a group to help offer a PPO network for physicians only. In fact, it's a physicians only network. And you can choose either Prime Health as the physicians only network, or you can also choose PHCS as the physicians only network as well. These are on our website. You can see the listing of the directory of the physicians that are in there. But for the employer that's making a move to level funded, maybe they've been on fully insured all along. Now they're going to make a move to a level funded plan. And then we're also asking them to go without a network. This hybrid becomes a really great stepping stone, offering still a physicians only network. And then the facilities would be paid utilizing our reference based pricing model, our Freedom Open Access as well. And now the pricing on this is going to be considerably lower compared to a full major medical plan with a PPO plan. So it's still a full major medical plan. We're just offering a physicians only network for the upfront piece of it. And then you're going to have access to the reference-based pricing on the facility. So it's really giving you another option of a product from Allied National to offer that should stand out in the crowd and be in the form of a hybrid to help and assist your client with that product. That's called the Freedom Hybrid product as well. Of course, we have a variety of plan designs on a traditional Freedom plan as well, and that really a traditional Freedom plan comes with a variety of plan designs. I think if we were to put them all on one piece of paper, you'd have hundreds of plan designs that you could create and design that could be beneficial for your client as well. Then we also have our PPO plans, and the PPO plans that we offer nationwide networks on are going to include Cigna as an option. I mentioned PHCS as well, First Health, or some nationwide networks as well. Then, depending upon the region of the country where your client's at, we have some regional PPO options that are available at that standpoint as well. So we cover the whole gamut on the full major medical plans, utilizing our Freedom plan with the hybrid, as I mentioned, and then also with our PPO plans, and then our traditional Freedom plans, which has no network at all, and allows the member the complete freedom to choose any provider they want to see. But the last product I'm going to talk about here on that featured Freedom plans is our Essentials plan. And that Essentials plan is unique because it's the most economical plan in the major medical category that we offer. And it's such that we cut out a feature that you might not at first think is really a great benefit, but it really is a tremendous benefit in that we cut out the Tier 4 specialty drug. And so when you submit your group, and it's learned through our online underwriting modeling that we're using for groups 10 or lives or larger, we're using gradient underwriting. And if we learn, that is the underwriters learn that there's some high cost drugs that are in there, as opposed to just offering a decline because it's going to be too costly to offer a quote and put a quote out there in the marketplace with the consideration of the high cost drugs maybe they're using, we can offer a Freedom Essentials plan that becomes an alternative that you can then show to your client to show what the rates would be under the Essentials and allow that employer the choice to make a decision on whether they want to forego not having coverage for the Tier 4 specialty drugs and allow that member to maybe seek alternatives through the patient assistance plans that some of the drug manufacturers have, or discounts or rebates if there's are available as well as an option, or have that member, if they so chose to want to go to the Affordable Care Act plan as well too. But that Freedom Essentials becomes a great option to recommend to your client when there is some cost of medical issues that in regards of the drugs there per se, that would otherwise be declined can be an offer for a group health plan as well. Then remember that all of our plans also come on the major medical side with the health, really what we call My Healthcare Assistant, and that's going to allow a member to have the complete freedom to be able to reach out to our nursing team, our health case management, and ask any question they've got. Maybe they've come from an office visit, and I don't know about you, but if I have an office visit and I get to my car and I think, what did that doctor just say to me? What's the prognosis that they're suggesting that I go through this treatment plan on? Well, if you had a question, certainly you can call your primary doctor for that, but you got a source here with My Healthcare Assistant to ask that nurse, that health case management, any type of question about your health care, about what the terminology that was used in the office visit, the treatment and the conditions that come along with all that. You'll be able to speak to someone pretty quickly with a toll-free number and be able to get any type of question answered through My Healthcare Assistant. We also have a type of a wellness benefit called our Health Choices that can be added on to our Freedom plans that offer a 6.5% discount just by adding the feature to the plan. And that feature becomes really tremendous to offer because not only does it offer a discount on the rates as well, but it also offers to you an opportunity to, well, allow the members to engage with our healthcare management because the members are requested to call in to Allied if they maybe have a obesity issue, maybe they've got a cardiac issue, maybe a diabetic issue, even mental health, substance abuse, or high cost drug for that matter, if they're getting ready to take as well. We want to have an opportunity to engage with them, to speak with them, and maybe make some suggestions on what could be a better treatment plan. But we just want to have the opportunity to talk with them. They don't necessarily have to take us up on our advice. We'd hope they would, but if they wouldn't, they're not required to do so. But by engaging with us, we award an instant 6.5% discount by adding the Health Choices feature to the plan. So that becomes the options that are available to you through Allied National. And of course, we have our new underwriting processes as well. I'm going to quickly tap into that just real briefly again for the groups that are under 9 lives or less. Used to be that it was 14 lives or less. Now we're changing that to 9 lives or less. And what we're doing with that is we're still going to require health applications for groups that are 9 lives or less. But with that, we're going to go ahead and require that we get a census form that tells us the information that that we need to have to generate the quote for you as well. It'll be an Excel spreadsheet. And then we're also going to request that you provide us requested plan designs as well. And the big news with our 9 and under underwriting is that we're going to accept all applications. That's really a great piece here. So whether it's Allied National apps or it's Allstate, Blue Cross, Healthcare, or even state applications as well, we'll accept those. But we'll say this little caveat. If you offer Allied National health questionnaires, we're going to give you an instant 5% discount for submitting that at the initial request for proposal. Now that's big news for us to be able to do that, a 5% discount if you use the Allied National apps. Now, if you submit a group now starting at 10 lives or greater, then we're still going to request a spreadsheet of all the dependent information as well. We're going to use the gradient underwriting model. So we're not going to ask you for health applications. We are going to ask for the group name, the address, zip code, and nature of business. We are going to ask you to provide the dependent information on the census as well, the family, state, zip code, dependent information, requested effective dates, and the requested plan designs that you want as well. Now, we're going to offer to you a firm rate, but keep in mind that any change in the census is going to affect that category as well. So we'll try to hold the rates as best as we can, but sometimes we add on certain members and the rates can change based on what we receive after we've issued the firm rates before the group commits to the plan type. So that's big news with what we're offering. So we recommend that you provide current plan design and rates. We recommend that you provide the renewal package. And by providing to us any type of large claims reports, we're going to give you an instant 5% discount when included with the initial RFP as well. And that's really great news about our new underwriting process. One last piece, and we'll close on this. Our additional changes are that our eligibility for participation has indeed changed, and we're so excited to offer to you eligibility of 40% of the group's eligible employees or 75% of the eligible employees after valid waivers. Whichever of those two options works out best for you, you can offer participation either 40%, regardless of waivers, or 75% of the employees after waivers. Plus, here's the big news: no tax and wage reports are no longer needed. And that's really wonderful news to make it easier for you. And starting in September, we're going to have a new simplified employer statement, and we're going to have a new enhanced digital signature procedure as well that will be available in September as well. Okay, we're going to open this up for questions, but I'm getting a note here that someone has already seen that we've got an agent bonus here available. So that is correct. We do have an agent bonus that is available to unlock really your unlimited earnings with our new level funded bonus plan. We have the opportunity for groups up to 4 lives or greater, whether they're the cost saver, whether there are full major medical plans. Any agent that writes 4 new business groups between now and the end of January, actually right up to February 1st, we're going to award for the funding advantage plans, we're going to award up to $50 per employee in that group. So say, for example, let's say you write 3 of our funding advantage major medical plans, whether they're the Freedom Plan, Freedom Essentials, Freedom Hybrid, or they're a PPO plan, you have the opportunity to unlock $50 extra per employee. So if you write 3 funding advantage plans, let's just say, for example, they're 6 lives each, and maybe we'd hope that you'd sell a cost saver plan as well. The cost saver plan would be, say, for example, 10 lives. We're going to pay on the cost saver plan 10 10 employees would be $25 of additional bonus per employee. So the cost saver plan, one of those is example of 10 lives. Then you write 3 funding advantage groups with 6 lives each. That's going to give you a bonus of $1,150. Now, you can't tell me you can't use an extra $1,150. We're going to provide that to you. We'll even help keep track of it as well for you there too. Okay, we are at our time limit here. You have been very gracious to sit in on our webinar and to listen and to learn and to grab hold of all the many new things that we're doing. We first want to say thank you, thank you, thank you for taking time to join us on the webinar today. I see we've got some questions that are here. I'm going to answer a few of those, then we'll wrap this up so we can get you back to being productive out in the field as it may be. We still will send you uh, all these questions that have been asked and provide those answers. And we'll also provide a recorded copy of this webinar as well. Looks like the first question I'm seeing here that is pretty easy to answer. It says, is the cost saver and the MEC plan, is the cost saver a MEC plan or an MVP plan? Good question. The cost saver plans 1 and 2 are MEC only plans, and then the plan 3 is a MVP product. So it really is classified as a bronze plan and does indeed meet the minimum requirements to be both a minimum value plan and a minimum essential plan as well. And remember, the cost saver requires no medical underwriting as well, and you have a network choice of either PHCS or First Health on that as well. Let's see if we've got another question here that I can answer for you as well too here. Okay, it says here, well, this is a good question. What is the agent comp on group major medical plans? Again, well spoken. So let's answer that for you. The default compensation on our group major medical plans is 8%. So we're not going to pay any commission on the small miscellaneous fees. Sometimes there's some PPO fees or such that they're really minuscule fees, but it works out to be about 8% default. Now, if you want to pay yourself more, then you can increase that comp, or if you want to decrease it, you can do that as well. So you have that luxury to do so. You should tell us that front when you're getting ready to make your submission that you want X amount of percentage of compensation, but it is 8% comp on our major medical plans. For the cost saver, although this was not asked, I'll go ahead and give that to you as well. It's 12% compensation. And for our MEC plans, they are 10% default compensation. Okay, let's take a look at another question here as to what is coming on the horizon here that you've asked here. Okay, here it is. How can Allied guarantee to protect a member against not paying a balance bill? Well, I didn't really get a chance to talk about that, but somebody is asking about balance billing. So good question to bring up. So Allied does have a means of protecting a member against a balance bill. Now, overall, Allied cannot stop a provider from sending a balance bill, but we can certainly ask the member to send us a copy of that balance bill to our elite client services. I did make references early on about our concierge team or elite services, it's also called as well. So you get information when you get signed up with the Allied plan, the member will, about how to reach our elite client services team. There's a toll-free number to call in. So we ask that you send that balance bill to Allied, and we're equipped. Our team is equipped and has done this for a number of years. We're very well experienced in the balance billing area. And I'm proud to say less than 1% of all of our claims even come out with a balance bill in the first place. But if you do have a member that gets one, we'll guarantee to protect the member so they will not have to pay anything extra above and beyond what they've already paid out on their benefits. So we'll get the balance bill, we'll call the provider, we'll work out and negotiate the paid amount, and then we'll pay it. It'll either come out of the claims fund of the employer or it will come out of the stop loss insurance protection as well. So that becomes really a neat guarantee feature with balance billing from Allied National. And also, if you get pushback, which is getting to be rarer and rarer these days, but if you get pushback and a provider says, I don't know about Allied, on your ID card is a toll-free number as well. The provider can call and get benefits verified very quickly on the telephone, and to explain how the coverage is paid. And if the provider still has a question about it, we'll negotiate right there on the phone and work it right out so the member is free to use the coverage and the benefits there with what's agreed upon going forward. Okay, another question here. This will probably have to be our last one because we're pushing the 45-minute mark. We got started a couple minutes late. So thank you again for your patience today with that. So this question reads, if a class of hourly wage earners wants a MEC plan, can we sell the MEC plan and keep the other classes on the other plans? Again, a great question. So the answer to that is yes, we do treat each class group as its own group. So if you had, say, for example, a class of wage earners that the employer, maybe they are an applicable large employer, and they still don't have any coverage and can't afford anything for those hourly wage earners, here's where that MEC product could be a perfect fit, either the cost saver or the MEC plan with the buy-up options as well. You can sell just to that class group of, as long as it's a non-discriminatory class that you're offering it to, such as wage earners, hourly wage earners. Maybe you got a restaurant group that's got your cooks and servers or waitresses and waiters that are in that class, just a non-discriminatory class. You can offer those products, as I mentioned, to that group. And even if you've got those other classes, maybe the management on another plan with another carrier, although we'd like to have an opportunity to help quote that other class as well. But you can leave that with where it's at, and you can sell just the class group that you have a need for with the MEC products that we've talked about as well. So good question. So we're very much about helping you with both offering class options, dual class as well, and we can also offer dual options as well. An example might be with the cost saver. You could offer a dual option with the plan 1 or plan 2 or plan 1 and plan 3 with that as well. So that's a dual option that's available, and you can do a dual option even. I didn't mention it, but we definitely offer HSA products as well. All of these major medical plans are compatible and can provide an HSA concept product there as well for you. We don't do the savings account for you. You can find that probably through a local bank or any other provider that you work with, but we provide the insurance product, the HSA itself, and with the plan designs that would make it compatible as an HSA. And with that HSA, again, you can offer maybe a dual option. Some members go on the HSA, and those members that don't want the HSA can have the non-HSA plan design that you want as well too. So lots of flexibility, lots of ways that we can help and serve your groups. And the way to get started is to call our sales team here at Allied National. So we'll close on this note that feel free to reach out to us at our sales number, which you'll see my phone number on the screen. I can help you as well. But our toll-free number is the 800-825-7531. You can press the menu option for sales, and our sales team can help answer your questions, help with your quotes, help with your submissions. We look forward to a great fourth quarter coming up, and we think with these improvements, such as improving the participation requirements, where we're only asking for 40% as compared to 50%, lowering our opportunities with the what we call the gradient underwriting for 10 lives or greater with a pathway with no health applications required. And for those that are under 9 lives now with completing health questionnaires, you can use all types of health competitor questionnaires you want to, but there's a discount of 5% if you use the Allied apps as well. We've done some things, and we're working and continually working to help make this process easier for you and to allow you to have the opportunity to sell more business. We appreciate our relationships with our agents and you taking the time to listen today. Have a great day and a successful, happy fourth quarter as it's really right on the coattails of happening. Thank you again. Have a great day.